And I need to link this conversation to the other event. I'm having some trouble with links going from my computer to my phone. Let's see if it works the other way. All right, looks like we have maybe a few people joining us. Welcome, everyone. Thank you for joining this live attitude session. Sharon, do you want to introduce yourself while I update our event?
Absolutely. I'm Dr. Sharon Saline. I'm a clinical psychologist, author, speaker, and consultant. And I'm coming to you from Northampton, Massachusetts, where it's a beautiful day, sunny and cool, not too hot. And I'm really excited to be here and to talk a little bit about RSD, which I'll be doing a webinar on in October. So that'll be more in depth. I believe that webinar is for couples particularly. So I'm very happy to be here to talk about RSD, or as we know it,
Yes,
rejection sensitive dysphoria.
indeed. Okay, and but as I get this sorted, general manager at Attitude, and today I will be helping to just facilitate conversation. Sharon will really be leading the show, and we will do our best to answer the questions that come in from our live audience about ways to manage rejection sensitive dysphoria sort of in the real world. And so we may have some resources to suggest as well as some strategies. And so please, as you come up with questions, please add them in the chat and we will do our very best to address those questions in real time.
Great. So I think we should start by explaining what RSD is. So unlike social anxiety, it is not a formal diagnostic category. So social anxiety is kind of the umbrella of a number of kind of syndromes, such as RSD or perfectionism or imposter syndrome, and they fall under the umbrella of social anxiety because they all really deal with a fundamental core belief that a person is deficient. So it's based on this this disconnect between how you appear to others and your own exaggerated and often negative perception of yourself. And these are false beliefs that are usually uh, statements of ways in which you fall short. So they could be something like, I embarrass myself, or I'm not much fun, or I'm not that smart. And so you won't go to a new social event. You won't walk into a cafe and order a cup of coffee and a muffin because you're worried about embarrassing yourself. And the presence of social media has made social anxiety a lot worse. Now, RSD falls under this umbrella because it shares that core belief of deficiency. But it's a syndrome that was named by Dr. William Dodson after years of observing traits and behaviors in patients with ADHD. And it refers to unbearable feelings of pain following an actual rejection or a belief about a rejection. And that these intense feelings, which can be related to emotional dysregulation, lead to an expectation that other people are going to pull back their support or their love or their respect. And it causes, again, this extreme emotional pain even when no actual rejection has occurred, but you imagine it or you feel like something's happened. And I think it's also important to say that some people believe that RSD is a trauma response, and they don't really think that it falls under the social anxiety uh, umbrella at all. That it's related to a history of trauma. Dr. Dodson doesn't agree with that. One of the things that happens with people with RSD is because of these past hurts or these perceived rejections, they don't reach out socially to other people or manage conflict directly or feel like they're good enough. And so they believe that these core beliefs are not only that they're true, but they become quickly overwhelmed by intense feelings of anger or hurt or shame or sadness, and you just might withdraw because you're afraid that you don't want something that's going to hurt you to happen again. And this withdrawal actually is kind of a self-defeating cycle because you're not having other experiences that would correct your misperception of yourself or this idea that you've been rejected and you are rejectable.
Mm. A little bit of it becomes a self-fulfilling situation.
Exactly. Right.
And um, we have heard it described by attitude readers. I mean, just to underscore the point you're making, as a very intense
Mm.
physical pain,
Right.
more than just an emotional hurt, but actually a physical pain experienced with real or, as you said, perceived rejection. So severe that um, you almost have a physical withdrawal
Right.
from
You have this, it's like a punch in the gut. If you've ever in an experience where, suddenly someone starts screaming at you, it's like, it's a whole visceral kind of reaction. Like for me, there's like a sort of a caving in and stop, stop, and 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 then I'll think about, well, did I do anything? And then of course, I hadn't done anything, but that's the position that I'll take. There's some belief that somehow I've done something wrong when there's no proof of that. And this can happen not just because you have RSD, but because you might have grown up in a traumatic family, or maybe you are the child of narcissistic parents, or there's a whole host of reasons. But one of the things that we want to remember is that just because you live with ADHD and you struggle with doing something in a timely fashion, or being able to perform a task on demand, or whatever, or be organized, or whatever it is, manage your emotions, doesn't mean that you're weak or incapable. It's just that people with RSD are wired to feel things more intensely and to replay unpleasant interactions over and over again. I had an experience this weekend where I was visiting family, and one of the family members like lost their temper, and just as I kind of walked into the kitchen and started yelling, and I basically was sort of shocked, and I was like, "Why are you yelling at me? I haven't done anything." And the person was said, "Well, I'm just yelling. I'm yelling at everybody." And I was like, "Well, I'm here, and it seems like you're yelling at me." And then, that person went in the other room, and along with another person, I'm trying to be really diplomatic here, was said, "Oh, Sharon, she's so sensitive, and blah blah blah." Like there was something wrong with being sensitive. And
Mm.
and I was like, "Hello, my sensitivity is like a badge of courage that I wear out in the world every day. It helps me do my job, and you all are just impossible, and there is no reason to yell in the first place." So it is kind of confusing. And if you grew up and you were told, oh, you're overly sensitive. Like I was called super sensitive Sharon, and my father and my brother. And, it's like there was something wrong with that instead of something good about it.
Mhm.
So that kind of can add to that sense of like, I'm deficient because I'm in the situation that seriously seems crazy and I'm upset about it, but no one else seems to be bothered. What is
Mhm.
wrong with me that I'm bothered? Or, what I would say to me in my situation, if I were outsider, I'd be like, what is right with you that you're bothered by this? Um,
And um, I should mention that RSD is um, commonly experienced by people with ADHD, but it is not um, a a diagnosis, and it is not included in the DSM-5 symptoms for ADHD, which it triggers a whole host of problems with clinicians and other healthcare providers sort of recognizing that this exists and providing treatment to help individuals who are experiencing it. Sharon, your
I'm
video is
frozen. I know.
frozen.
Can you hear me?
We can hear you, so I think that
Okay.
you can
Should I leave and
try
come
to
back?
rejoin. We can give
Oh
that a
god.
shot. I think that will be a better experience. So
Hold on,
thank you, everyone.
let me just turn my camera on and see if that works.
Okay, we'll try some troubleshooting. We're still we've been experimenting with
This is
YouTube
not
Live.
working, so I'll come back.
Okay, so
Bye.
Sharon will rejoin us. So while she's rejoining, I would like to invite once again everyone who is listening right now to please contribute your questions. Ask your questions of Sharon about your challenges specifically with RSD. It could be in a social setting with loved ones, as Sharon was discussing with her family. In a work environment, we hear quite often from people who experience criticism, even if constructive, on the job quite severely. And of course, with friend groups. So, if there's any way in which RSD is really impacting your health, happiness, ability to be in the world and experience things, please let us know. And Sharon will be popping in here again in a moment, and she will be answering your questions. So, in the meantime, while I wait for her to jump back in, um, let's see if I can. Sorry, guys, we're here we go. Um, we are troubleshooting this whole. Um, in the meantime, while we wait for Sharon to rejoin, I did want to recommend if you're interested in learning more about rejection sensitive dysphoria. As Sharon mentioned, Dr. William Dodson is really the one who coined this term and sort of introduced the concept of RSD in some great articles that he wrote for AttitudeMag.com. So if you on our site search RSD or rejection sensitive dysphoria, you should see those articles pop up to the top, and those are really sort of the signature um, the signature pieces. And goodness gracious, we are really having trouble here getting. So Sharon is joined, but she's not on video. Okay. I don't suppose we have any YouTube experts in the audience here. Oh gosh. Okay. Sharon, I texted you the link again. So if you check your texts, there is a link there to join as a guest. Okay. Oh, here we go. Okay. Thanks for your patience, everyone. It looks like we are back.
I'm
Okay.
back.
Okay,
Yay!
wonderful. So I was just giving a little bit
Okay,
of
great.
more
So
background,
I
but
see.
we do have a few questions. Yes.
Okay, I see that there are some questions, so I'm going to dive into those. Hi, everybody. I'm glad to be here. Um, Floor Slab says, "What do you think about rejection therapy? Asking someone out, trying to branch out with the intention of being rejected." Yeah, I'm not a big fan of that. I don't understand why you would do that. I think that there's enough rejection in regular life. I think that it would be better to ask someone out to do something where you have a common interest, you have some sort of a relationship in some way, and you build on that. Somebody says, "I'm recently diagnosed ADD, late diagnosis, 44, and I lost my job in July." I'm so sorry. I don't know how to proceed in a new environment. I'm really scared. I can understand that. I think that anyone feels nervous when they start in a new environment, or whether it's work or school or social, going to a social event. And really, the thing that we want to try to do is to first limit our negative core beliefs and that negative self-talk that tells you can't do it. So what is some evidence that might contradict the belief that you can't do it? When is a time when you did enter a new situation and it went pretty well or well enough? What did you do in that situation to make it successful? I think that's something that where you want to start, because if you can recall a situation where you were uncomfortable and you did something anyway and it worked out okay, then you can take those skills and apply them to your new work situation. Um, it's our past successes or survivals that really guide us through our current discomfort. Um, so these past successes are proof that you can succeed again, and that's really important. Another thing that we want to do is to plan some positive self talk phrases to reinforce your strengths. So, we have an inner ogre, as I like to call it, who is, also known as your inner critic. And this inner ogre spews all kinds of critical, mean, nasty, judgmental things in order to protect your vulnerable self. Its job is to protect you from experiencing more pain. So it tells you bad things about yourself so you don't go out and do something that could cause you harm. It doesn't really make sense, but I think it works that way. And then on the other side of the other shoulder, we have your inner champion. And this is the person who believes, this is a part of you that believes in you, that encourages you, that says, you can do this. And so what happens is most people want their inner ogre to just go away. And we can't make it go away. It developed over time to actually um, it developed in some ways to protect us. Shrek, if we think about Shrek, he's really rough on the outside. He has that sign that says, "Go away, get off of my land." But inside, he's kind of a softy. And so that exterior, that sort of rough exterior helps him make sure that that soft interior doesn't get wounded again. And sometimes that harsh exterior is made up of voices of people who ideally were trying to help you, learn something about yourself, do something differently, but they didn't know how to couch it or join with you in a way so you felt like they were on your side. Instead, you felt like they were putting you down or they were critical or telling you all the ways that you messed up and weren't okay. Um, Sometimes that harsh voice is actually not really protective. It's just an amalgamation of people who were cruel to you, not necessarily on purpose, but sometimes. I know that I was bullied when I was in sixth grade, and one of the things that I think I took away from that was that I wasn't. I wasn't worth being friends with. I was in sixth grade, and that is not true. But if I have an issue with someone, and I recently have had an issue with someone who, for some whatever reason I truly don't understand, and luckily my husband doesn't either, so it makes me feel like I'm not really crazy, has decided to, you know, kind of cut me off, per perhaps forever, but definitely for a period of time, which was super hurtful. And I was like, why? This is just really bothering me. I've known them for like 30 years. What's going on? And I realized that it had triggered the time when I was on the playground and people put
Mhm.
worms in my lunch and everyone laughed when I cried. So it's just so interesting. And because I feel as an adult, like, yes, I'm a good friend, I'm worthy of being a friend, but there's still that little part, with that exterior that says maybe not, right?
Right.
So we want to think about that. And then we can't, basically tell that person to go sit down and take a nap. It's not going to work that way, that part of ourselves. But what is going to work is to build up that inner champion, so that that champion can then talk to the ogre and say, you know what? I know you're scared. I know you're worried, but I've got this. And I did that in my family situation, where I said, actually, you know what? I haven't really done anything wrong, and I don't know why you're yelling at me. And I was like, who said that? Right. And that was my inner champion. It came to the rescue. It has learned to say something. And I think that that has taken practice, because it's easy to get angry and defensive in those moments. But, and then everyone talked about how sensitive I was. And I was like, I'm going to take a walk. I just like went for a walk. And I was like, I'm sensitive. Yes, I am. That's a good thing. And the champion was just really trying to help, you know normalize the situation and build it up. So
Mhm.
in internal family systems, we talk about these different parts, and Dr. Schwartz talks about the manager and the firefighter and different things. And I'm trying to simplify that because it's complicated. So if we have this ogre that can tell us negative things and put us down, so that we don't like expose ourselves in any way that could be dangerous or uncomfortable. And we have our inner champion who's like, come on, there are past experiences where you've stood up for yourself. This is a time you could practice X. There's
Mhm.
really a dialogue. And when there's a dialogue and the champion can rise to the occasion, our inner light can actually shine. And
Mhm.
that's kind of the goal. We call that the self. Carl Jung talked about it, Richard Schwartz talked about it. And it's that inner lit light of ourselves, right in our solar plexus, that is the part of us that is here in the world, that people want to know, and is unique and special.
Mhm. Bryce asks, he says, when he is feeling nervous, he blanks out on those past successes. And
Mm.
I know other people, when they are triggered with anger, when they're triggered with embarrassment, any number of emotions can like wipe your brain clean of those past successes. So you talked about practicing some mantras. Is there like should
Right.
we be making a cheat sheet like
Yes.
on our
So
phone?
there are two things that we want to do. Actually, having a cheat sheet on your phone is a great idea. Some things like, I'm doing the best I can in a complicated situation, or I'm sensitive, and that's actually my superpower, or I can be very outgoing and funny, instead of I'm too much, right? So we want to have a couple phrases that you can look at on your phone, in when you go to the bathroom and you excuse yourself. You're like, excuse me 1 second, I just have to go to the bathroom. And then you can go and you can look at your phrases and think about, which ones you can use. And you might even think of a time when you did that and put it next to the phrase. You could also do something that I find very helpful and research actually supports, which is at the end of each day, you can talk into your note section, or you can write in a journal 3 good things that happened. And they don't have to be like good. It could be just good enough. Like, um, I really liked my tuna fish sandwich today, or I had a great conversation with my boss, or my husband went grocery shopping and brought me flowers, something like that. So it can be anything like that. It can be small too. I got to work, I got up out of bed when my alarm went off, which isn't a small thing for a lot of us, but it can be. Or I really enjoyed, throwing the ball for my dog or something like that. So those are 2 things that we can really do because we want to shift away from that negative talk. We want the champion to grow, and the way that the champion is going to grow is by feeding it positivity, positive statements, experiences. And even if something isn't perfect, if it's just good enough, like I didn't have a perfect hair day, but my hair was all right, or something like that. Or I like this blue shirt and it looked good on YouTube. That's something I might want to write down. It's not that important, but it made me feel good. So what makes you feel good? And this is hard for a lot of people with ADHD, particularly those who can be depressed, because when you feel bad about yourself, nothing seems okay. And
Right.
so this is a really important tool to practice.
I love that idea of taking the time at the end of each day to reflect on 3 good things or more. But I know, like my husband says to me often, you only hear the negative. You don't hear when I tell you um, something was awesome, whatever, that, this dinner that you made was amazing. Like, I don't, so I'm working on being more mindful and hearing the
Mm,
praise and allowing the praise
to
in.
come in.
Mhm.
Right. And that praise needs to go all the way in right here into in your solar plexus. It's interesting because a lot of people with ADHD also struggle with imposter syndrome, and which is also under that social anxiety umbrella. And with imposter syndrome, what we tell ourselves is A, it wasn't that big a deal. B, it wasn't really that good. Or C, yeah, it was luck, right?
Right.
And luck, and in each of those situations, we're diminishing the fact that actually it wasn't luck. It was us. It was our effort. It was our competence. It was our interest. It was something that we did that makes it happen.
Mhm.
I noticed that there's a comment. I struggle with emotional dysregulation and had a difficult situation today at work in a team meeting. I find my manager is triggering for me and I get emotional. I was told I made the team uncomfortable. That sounds really hard. And I can understand your perspective, like of shame around your emotional intensity, and I can understand why other people feel uncomfortable. And I think the thing is that if you're noticing the physical symptoms that you're becoming dysregulated, and this is what we have to do, and it's so hard for so many people with ADHD, is to actually pay attention to the cues our body is giving us. For some people, it's a little knot right here. That's what it is for me, or sometimes some tightness in the chest, or maybe your hands get sweaty, or you find you're clenching your teeth. These are all signs that you're headed off into the land of emotional dysregulation, and we need to have pre-planned tools to bring us back. So if you're feeling like you're getting dysregulated and you're in a meeting, you can excuse yourself and go to the bathroom. People have to go to the bathroom, and other people understand that. Rather than staying in a meeting where you're feeling uncomfortable, you could focus on your breathing. You could put your hand right here. I'll try to sit up so you can see it, right here at your diaphragm, and just feel your hand go in and out. and breathe deeply. Breathing is what's going to slow your reaction time down. You could also, what I would encourage you to say is, I think I got dysregulated yesterday. I wish I hadn't, and I'm sorry, and I want you to know I'm working on it. And that kind of levels out the need to criticize you because you've already owned it. You're
Mhm.
accountable for it, and you're not shaming yourself. You're just saying, this is something I'm working on. Thanks a lot.
Mhm. That's great advice. It was We have a comment here saying that the list of past successes or mantras, they keep it as actual paper because that
Mm,
sensory experience is helpful. And this reminds me of some of your advice in the past, Sharon, about mindfulness and
mhm.
having some cues to stop, feel, feel the paper,
Feel
read
the
the
paper,
paper,
right.
be in the
Yeah.
moment. So that's great.
One thing that can be helpful is when you're becoming dysregulated is to slow down and look in your environment and identify three things. Oh, I see that painting of a bridge. Oh, I see Tom taking out a piece of gum. And I see, Joaquin taking notes. So that kind of, again, slows you down. The whole thing with emotional dysregulation is the speed with which it takes over, and that has to do with having some actual neurological differences in brains with ADHD, that have to do with maybe smaller amygdalas or the cingulate gyrus or other fancy name parts of your brain and your limbic system that react too quickly because the information comes in too quickly, and that has to do with differences in processing.
Mm. Um, we're running a little short on time here. We did have some technical difficulties, but I think we have two more questions.
Okay.
If you can fit them in. Ender writes in more of a comment, but saying that with RSDs, learn to become numb and almost accept it. And he said, deal with the situation swiftly and then manage the emotions
Mm.
later in private.
Mhm,
That's kind of a
mhm.
compartmentalization, yeah, of what the
Absolutely,
RS.
and if you're able to do that, if you're able to take your whole feelings and, like, let's make a deal, put it behind the curtain, and then call someone who's your lifeline and talk about it, then that's a very healthy way to do it. You might also wanna look on my website. I talk about the star response: stop, think, act, and recover, and, that's where you take a pause, you think about what the next right action is, you do that next right action, and then you give yourself time to recover. So that's something to think about as well.
Yeah, and Ender just wrote back in the exact same moment you were saying that, saying that's what they use: stop, think, observe, plan, proceed. A little different, but
Little
same
different,
idea.
but yeah.
Yeah,
Mhm.
yeah. And then we had a question from Jessica that was great. How to manage RSD during the job search process, which is filled
Yeah,
with real rejection.
absolutely.
Yes, yes.
Absolutely. I have to tell you that when I was writing my book, my first book, I sent out, my proposal to, like 20 agents, and it was rejection after rejection after rejection, and really it gets you down. It's hard to kind of hold on to yourself in the presence of nope, no, we're filled. Thank you very much. Fully committed, whatever it is. And so what we want to do in those situations is remember that it's not personal. Like, this is not the fit for you, and the right thing has not come along yet. Yet is the most important word you can say. It's absolutely okay and important to say, boy, this really stinks. I don't like this feeling. And to have some activities to do if you are rejected that can help you shift. Who's that lifeline call? Take a walk, go for a run, ride your bike, and be able to say yourself, the right thing is still coming. The right thing is going to come to me. It's important when you are looking for a job to remember to really hold in your head the image of what it is that you want and ask for it. I'm asking for this. And the more specific you can be, the better, because then you open yourself up to the possibility that it could actually come your way. My website, someone asked, is www.drSharonSaline.com. And I have a handout that I'm going to be sending to Annie as soon as we're done for her to put up with this video. Blah, blah.
Yes,
Um,
I
so,
will. I will link to it. YouTube doesn't let us link in the comments, so I will link in the event description. If you go back to the video replay, I will link to Sharon's resource and also to the section of attitudemag.com that goes deep in depth on rejection sensitive
yeah,
dysphoria.
I do want to say one more thing, Annie, about this job thing, because I see someone saying, it's a lie. When you're rejected, it's completely personal. Yes, it can be personal. Like, you can be down for a job where it's you and three other people and they pick someone else. Of course, that's going to feel personal. And of course, you're going to be disappointed and upset and sad and frustrated and scared. Of course, all of that is true. And um, have your feelings, have them, honor them, acknowledge them, and then, give yourself the rest of the day, or whatever you need. And then how are you going to cycle back to start over? Because it is really, it is distressing, and sometimes it's about you, and sometimes it's about what they're looking for, and you may not have what they're looking for, and boy, does that hurts, and that's okay, to be hurt and to be upset. um, and how are you going to learn from that experience? What are you going to take away that can help you in the next situation?
Mhm. Well, that is a nice note to end today's discussion. Thank you to everyone who joined us and participated. And thank you, of course, to Sharon for leading this conversation on RSD. And I will mention again that she does have a live attitude webinar, a full hour on RSD
Couples.
in couples.
Yeah.
So yeah. And that is in October. If you visit attitudemag.com/webinars, you will see the information there shortly. I don't think the page is live yet, but mark your
I
calendars.
don't think I've written the description yet. So there you go. Thank you so much, everybody, and have a wonderful rest of your day.
Thank you.